Are dedicated to my fellows, my residents who are really sincerely preparing the slides for me. Okay, so now the clock is just 1 minute before 8:59. I'm going to start the talk, and it's going to be parasympathetic ganglions of head and neck. So that's going to be the topic. So welcome Dr. Vinita Vijay, and oh, my friend John Bennett has joined. It's a great time. You see, this is Sri Harsha, Dr. Bennett. You wanted to know who is this IT guy. This guy is superlative in his IT stuff. And if you want to actually contact some regarding some real nuances of internet technology, this is the guy. And he helps me in so many things. Of course, Dr. John wanted to talk with you, Dr. Sri Harsha. You can actually converse with him. Okay, so let us get started without much ado. Now we are 9 o'clock. We are going to start. It's Indian Standard Time, 9 o'clock. Now, introduction. Parasympathetic nervous system is one of the two divisions of the autonomic nervous system. The other one being sympathetic nervous system, of course. So, parasympathetic and sympathetic nervous systems. The autonomic nervous system controls all the involuntary activities of the body. So I'm starting to teach the beginner also. So it controls the involuntary movements of the body. The parasympathetic nervous system controls the rest and digest system of the body, while the sympathetic nervous system, digestive system of the body, while the sympathetic nervous system controls the fight and flight response. The activities controlled by parasympathetic nervous system are salivation, lacrimation, digestion, defecation, urination, and sexual arousal. So this is a long question, so I'm putting the heading. If you get this parasympathetic ganglions of head and neck, you should start like the introduction and then go on to this slide and then go on. If you can draw this, it will be great. The parasympathetic system, you see, just draw the brain and then just the spinal cord, and then you can just draw the pupil, the heart, the airways, the liver, the blood vessels, the digestive system, uterus, and the urinary system. Okay, so here we are. I'm now going to go for the ganglions. So this is what we are going to discuss today, the ganglions, the parasympathetic ganglions of head and neck. A ganglion is a group of neuron cell bodies in the peripheral nervous system. The ganglia are primarily made up of stomata and dendritic structures which are bundled or connected. So you have a bundle of nerves which are connected, and that is a ganglia. The ganglia provide relay points and intermediary connections between different neurological structures in the body, such as peripheral and central nervous system. So it's actually a relay point. So you should understand that these are actually relay systems now. Ganglia often interconnect with other ganglia to form a complex system of ganglia known as a plexus. So they may ask you, what's a plexus? Plexus means the ganglia often interconnect with other ganglia. If two ganglia connect together, they form a complex system of ganglia which are called the plexus. In the somatic nervous system, this includes dorsal root ganglia and trigeminal ganglia among a few others. Okay, a pseudoganglion is localized thickening of a main part or trunk of a nerve that has the appearance of a ganglia but has only nerve fibers and no nerve cell bodies. So they will definitely try to ask you, if you are appearing for the Viva, the gold medal exam, they'll ask you, what is a pseudoganglion? So it doesn't have nerve cell bodies, so that's the pseudoganglion. Okay, now the nerve that supplies the ganglion is called the preganglionic fiber. So this is the preganglionic fiber. I'm using my cursor. Of course, you're not able to see that. So that's a preganglionic fiber. That's a ganglion here. And then you have the postganglionic fiber, and then you have the sense organ which it supplies. This is the simplest version. You can take this diagram. Most of these slides you can actually make it as screenshots, and just you can take it for your exams. You can just write this for your exams because they're all taken from very standard textbooks. The nerve that carries the supply for a ganglion to a sense organ is called the postganglionic fiber. So you have the nucleus, the preganglionic fiber, the ganglion, and then the postganglionic fiber and the sense organ. So this is how the ganglionic fibers are. Now, parasympathetic ganglions in the head and neck there are 4 parasympathetic ganglions. What are the ganglions? Number 1, the ciliary ganglion. Second is the otic ganglion. Third is the pterygopalatine ganglion. And fourth is the submandibular ganglion. So you might be asked in your exam any one ganglion as a short notes, or you can be asked as an essay. As you know, you can write the ganglions, parasympathetic ganglions of head and neck. So remember the mnemonic COPS, easy to remember, because you know the COPS is ciliary, otic, pterygopalatine and submandibular ganglion. So you can brilliantly remember this mnemonic COPS. Okay, the parasympathetic cranial nerves are cranial nerve 3, cranial nerve 7, 9 and 10. The 3, 7, 9 cranial nerves are a part of the parasympathetic ganglions, head and neck, while the cranial nerve 10 give ganglions in the trunk. So, what are the cranial nerves which take part in formation of ganglion of head and neck? 3, 7 and 10, 9. 3, 7 and 9. Remember this, 3, 7, 9. 3, 7, 9. All odd numbers. Tips to remember. Preganglionic parasympathetic fibers of the head and neck can be from cranial nerve 3, 7 or 9. But all postganglionic parasympathetic fibers of the head and neck are derived from cranial nerve 5. So it's so easy to remember. So you see 3, 7, 9. So you have 5 in between. So it is the tip. The preganglionic fibers are from 3, 7, 9. But the postganglionic fiber is from the trigeminal nerve. The nerve that relates to the ganglion, preganglionic nerve, is called the functional nerve. The nerve that relates from the ganglion to the sense organ, postganglionic, is called the topographic nerve. So you should remember what is a topographic nerve, what is a functional nerve. Functional nerve is preganglionic and the topographic nerve is the postganglionic. So you should clearly understand this. Now preganglionic fibers, so cranial nerve 3, that is the oculomotor nerve, giving off the ciliary ganglion. The 9th nerve, the aortic ganglion. The 7th nerve is pterygopalatine ganglion and submandibular ganglion. So this is preganglionic. 3, 7 and 9 I told you. So pterygopalatine ganglion, submandibular ganglion by cranial nerve 7, that is the facial nerve. The 9th nerve, the glossopharyngeal nerve, aortic ganglion, and the oculomotor nerve is the ciliary ganglion. Postganglionic fibers are all from the the 5th nerve, you know, the ciliary ganglion is V1, pterygopalatine ganglion is V2, aortic and submandibular ganglion is V3. So how easy it is to remember. You see, it's made so easy. So the preganglionic fibers from 3, 9 and 7, and postganglionic is V1, V2 and V3. Well, the nuclei of the parasympathetic ganglion belong to the general visceral efferent category. So it's called the general visceral efferent category. There are 4 nuclei in general visceral efferent, namely Edinger-Westphal nucleus of 3rd. So Edinger, you can have a short note on Edinger-Westphal nucleus alone. So please remember that. Second is superior salivatory nucleus. Third, that is the 7th. The 9th gives inferior salivatory nucleus, and dorsal nucleus of vagus is 10th now. Now let us go on to each ganglion, the ciliary ganglion. So you can be, as I told you, can be asked short notes of every ganglion separately, or parasympathetic ganglions of ENT, of head and neck. You can be asked the question like that. Now let us go to ciliary ganglion. The parasympathetic it's a parasympathetic ganglion located just behind the eye in the posterior orbit. Measures 1 to 2 millimeters in diameter and contains approximately 2,500 neurons. It is the primary tract for controlling the size of the pupil. Now, the nucleus of the pathway is derived from the Edinger-Westphal nucleus, which is located in the midbrain at the level of the superior colliculus. The Edinger-Westphal nucleus occupies the midbrain of a V-shaped oculomotor nucleus, while the periphery of the nucleus is motor. The nerve exits the brainstem at the level of the interpedunculaire fossa to the subarachnoid space towards the roof of the cavernous sinus. It runs parallel to the posterior communicating artery. Of course, I will show you a lot of videos of this. All these videos are going to come later as I deal with the later episodes. You will see a lot more of videos. Now the nerve then divides into an upper and lower division at the level of the superorbital fissure, where the parasympathetic fibers travel along the lower division and along the fibers supplying the inferior oblique. This forms a preganglionic parasympathetic pathway of the ciliary ganglion. Now the pupillary fibers of the nerve derive its blood supply from the pial plexus on the surface of the nerve. The core is supplied by the vasa nervosum, and the ganglion derives its parasympathetic supply from the plexus around the ophthalmic artery. Now here we are. the pictorial representation of the oculomotor nucleus, Edinger-Westphal nucleus, and the blue color shows the Edinger-Westphal nucleus. You see here, that's the Edinger-Westphal nucleus, and the parasympathetic fibers, the nerve runs right between the SCA and PCA. That's the SCA and PCA here. PCA is here, SCA is here, and the third nerve goes. That's the basilar, the ICA is here, and of course the two vertebrals are here. This is the pictorial representation of the nucleus, Edinger-Westphal nucleus. The postganglionic fibers pathway starts from the nasovicillary nerve, which is a branch of the ophthalmic division of the trigeminal nerve. So this is V1. As I told you, postganglionic is V1, V2 and V3. Now the nasociliary nerve gives short ciliary nerve, which then innervate the sphincter papillae and the ciliary muscles and cause constriction of the pupils. Hence, the functional nerve of the ciliary ganglion is the oculomotor nerve, while the topographic nerve is the nasociliary nerve. I think this is the simplest you can actually make to understand the reflex pathway. So the oculomotor nerve and the nasociliary nerve. Now, I'm going to pictorially represent this ganglion, ciliary ganglion. If you want to take a screenshot, you can take a screenshot of this preganglionic Edinger-Westphal nucleus, lower division of the third nerve, along with the fibers, and then you can see here the ciliary ganglion is here, and then the nasociliary nerve branch of the V1 goes to the eye. So that's postganglionic. So preganglionic, postganglionic. So what's the applied anatomy? You should write, if you ask ciliary ganglion, you should write applied anatomy also. The anatomical location of the nerve makes it susceptible to berry aneurysms of the SCA and the PCA. So you can have aneurysms which is compressing over it. PCOM is one of the most common arteries to develop an aneurysm at either end, making the nerve susceptible. In case of injury to the nerve, the parasympathetic fibers are cavernous sinus thrombosis affects the parasympathetic fibers of ciliary ganglion, first followed by the classmate as well. Thanks for being there. Now you can see here that the aortic ganglion is a small oval-shaped flattened parasympathetic ganglion. It is nucleus, and then of the glossopharyngeal nerve, the inferior elevated nucleus or the nervous nucleus salivatorius inferior is a cluster of neurons in the pontine tegmentum, dorsal part of the pons just above it, and then pass via the tympanic plexus and lesser petrosal nerve to the aortic ganglion. See how beautiful it is. This forms the preganglionic pathway of the aortic ganglion. So we will pictorially represent it. Lesser superficial petrosal nerve is sympathetic supply from the plexus around the middle meningeal artery. Now let us see this. This is, you can actually take a screenshot of this slide, the most important slide of the aortic ganglion. What? Number one, inferior salivary nucleus, aortic ganglion. If they write immediately, I'm sure people like Professor Anthony will definitely keep asking the rounds also. What is preganglionic for aortic ganglion? Inferior salivary nucleus. Second, glossopharyngeal nerve. Third is Jacobson's nerve. Then tympanic plexus, lesser superficial petrosal nerve goes to aortic ganglion. From the applied anatomy, the main anatomical application of the aortic ganglion is freeze syndrome. So freeze syndrome can be asked as a short giving the name freeze syndrome. So you can actually get a googly by actually this question like bilateral syndrome. Then you might be thinking, what is this? I've never this question like bilateral syndrome. Heard of this term. That is why we freeze syndrome often results as a side effect of surgeries or near the parotid gland or due to the injury to the auriculotemporal nerve, which passes through the parotid gland in the early part of its course. The nerve carries parasympathetic fibers to the parotid salivary gland, sympathetic fiber. Mentioning the term submandibular ganglion, he'll say Langley's ganglion. So what is Langley's ganglion? Langley's ganglion is submandibular ganglion. Submandibular ganglion is the small and fusiform in shape. It is situated above the deep portion of the submandibular gland on the hyoglossus muscle, not hypo. It's a hyoglossus muscle near the posterior border of the mylohyoid muscle. So posterior to the mylohyoid is the hyoglossus, and the ganglion hangs by two nerve filaments from the lower branch of the lingual nerve itself, a branch of the mandibular nerve. So you know, I dealt with the mandibular nerve as the first episode, and now you know where to fix that lingual nerve. So I told you the lingual nerve. The preganglionic parasympathetic fibers are from the superior salivary nucleus in the upper border of the pons. So superior salivary nucleus. It then travels via the facial nerve into the corner tympani branch, and the corner tympani then merges with the nerve sheath of the lingual nerve, which then goes on to supply the preganglionic fibers with submandibular ganglion. Hence, in this ganglion, both the pre and the postganglionic fibers are supplied by the lingual nerve. So you see how beautiful. Here alone in the submandibular ganglion, the preganglionic and the postganglionic fibers are the lingual nerve. Now, the postganglionic parasympathetic fibers are also carried by the lingual nerve. Even though preganglionic fibers are delivered by the lingual nerve, the functional nerve is still considered as the corner tympani nerve. Even though the preganglionic supplied the lingual nerve, it is actually the corner tympani is considered to be I'm getting a message from Professor John. Are other people getting interruption in the video transmission, or is it only me? Can you just answer him, because Professor John is from Miami, from USA. Can you answer him saying that your transmission is good or bad, so I can stop here and maybe wait for some people to comment? Here the streaming is very good, Professor John. I'm not sure why you're not getting the transmission. So so Dr. Manish Verma has typed good transmission. So Mutam Shilambu has also typed that it's a good transmission. I am waiting for some people to actually answer. Video going great. Mutam Shilambu, no problem here. It's perfect. No, it's smooth video. I'm sorry then, Dr. John, there's a problem with your side, from your side. Okay, so here we are, the postganglionic parasympathetic fibers, the oral mucosa and submandibular and sublingual salivary glands. They are secretomotor to these glands. Some of the postganglionic fibers reach the sublingual gland after they re-enter the lingual nerve. The topographic nerve is the lingual nerve. So clear. Sympathetic fibers are from the external carotid plexus via the facial artery and its branches. Okay, now let us go in for this. This is a screen chart. You can actually take a screenshot of this or a picture of this, because this is going to be the Langley's ganglion. If you want to write Langley's ganglion, this is what you're going to write. Now here we are, superior salivatory nucleus, facial nerve, chordae tympani joins lingual nerve, then the submandibular ganglion. Then goes for the postganglionic fibers, lingual nerve, again the submandibular, sublingual ganglion, sublingual glands. So that's postganglionic. So preganglionic, postganglionic. You see, in one slide you can completely write the whole answer if they ask you Langley's ganglion. So applied anatomy, in case of Bell's palsy at site B, as mentioned in the class of facial nerve, above the level of the chordae tympani nerve, there is a decrease in salivation. So we mentioned that in your the second class on facial nerve, and there will be a decrease in salivation. Complete loss of salivation is not seen because parotid gland derives its supply from the 9th cranial nerve. Now let us go on to Meckel's ganglion. So this is another important exam question. Again and again they are asking you short notes. Please understand this and remember this. Meckel's ganglion, they will say Langley's ganglion, Meckel's ganglion. Meckel's ganglion is pterygopalatine ganglion. Please, you have to remember this. It's the largest of the parasympathetic ganglions. It lies in very close relationship to the Meckel's cave, next to the foramen rotundum, where the maxillary nerve enters. It is a parasympathetic ganglion found in the pterygopalatine fossa. It is found in the pterygopalatine fossa. See how beautiful diagram. You can actually take a screenshot of this, and of course you can actually in fact in my dissections, even in JNA, I in fact show the ganglion so beautifully. And this is the trigeminal ganglion. That's actually the maxillary division of trigeminal nerve, and you see how this median nerve comes here. Of course, we will discuss that now. The preganglionic fibers start from the lacrimal nucleus, which lies just superior to the superior salivatory nucleus along the upper border of the pons. So lacrimal nucleus, and then travels along the facial nerve into the greater superficial petrosal nerve. So you know, in the first geno you get the greater superficial petrosal nerve, and then that greater superficial petrosal nerve joins with the deep petrosal nerve, which is the plexus around the internal carotid artery, and they both join to form the Vidian nerve, or the nerve or the pterygoid canal. Then the deep petrosal nerve is formed by the sympathetic plexus around the internal carotid artery. This forms the sympathetic innervation of the ganglion. The Vidian nerve, not Vivian, Vidian nerve supplies preganglionic fibers to the pterygopalatine ganglion. So postganglionic fibers are relayed by the maxillary nerve, the V2. It is carried along the zygomaticotemporal nerve, which connects the maxillary nerve to the lacrimal nerve. So it connects the maxillary nerve to the lacrimal nerve, zygomaticotemporal nerve. The lacrimal nerve then carries the postganglionic fibers to the lacrimal gland. The functional nerve being the GSPN and the topographic nerve being, so I told you, you should know what is the functional nerve, what is the topographic nerve. In the first part of our lecture, we already talked about the functional nerve and the topographic nerve. So please, my dear friends, you should remember. Now you have to now see this. This is the fantastic representation of this whole thing. Lacrimal nucleus, facial nerve, GSPN, GSPN plus deep petrosal nerve, plexus around the internal carotid artery, forms the median nerve. Median nerve is a nerve of the pterygoid canal. This is pterygopalatine ganglion. This is preganglionic. Postganglionic, you have V2, maxillary nerve, zygomaticotemporal nerve, lacrimal nerve, and lacrimal gland. So simple. This is all about the ganglions of the head and neck. Applied anatomy, the pterygopalatine ganglion is theorized to be a component of for a group of headache disorders classified as trigeminal autonomic cephalgias, which present as unilateral headaches with ipsilateral autonomic features. Blockage of the ganglion with local anesthetic, clinically referred to as sphenopalatine ganglion block, may be performed transcutaneously with a small needle or topically via the nose with a local anesthetic soaked swab. The topical SPG is used for treatment of persistent migraines and cluster headaches. Now, acute migraine attacks as well as other primary headaches disorders like cluster headaches are often associated with signs of parasympathetic activation. Blocking the sphenopalatine ganglion, which is a major parasympathetic outflow to the cranial and facial structures, is a reasonable target to help relieve pain and autonomic features seen in these disorders. Now, loss of lacrimation is seen in case of Bell's palsy at the level of the geniculate ganglion due to the lack of preganglionic supply to the pterygopalatine ganglion. Loss of lacrimation is also seen in case of Ramsay-Hunt syndrome. Okay, now let us go on to the summary. It is Dr. Prakash Monka says it's a very difficult topic. Believe me, this is the simplest topic. It's so easy. The next five slides, if you memorize these 5 slides, the ciliary ganglion is nasociliary nerve and functional nerve is oculomotor nerve. Pterygopalatine ganglion is maxillary nerve, so V1, V2, V3. See here, V1, V. So ciliary ganglion, COPS I told you, ciliary ganglion, pterygopalatine ganglion, otic ganglion, submandibular ganglion, COPS, COPS. And then here is V1, V2, V3, V3 again, lingual nerve. So maxillary nerve, auriculotemporal. And here is the 3, 7, 9 and 7. So 3, 7, 9 and 7. Now, this is the final 5 slides. Please remember this: preganglionic Edinger-Westphal nucleus, and then lower division of the third nerve along the fibers, and then going on to the ciliary ganglion, and then postganglionic nasociliary nerve branch to V1. So that's the first ganglion, ciliary ganglion. Next will be the otic ganglion, inferior salivatory nucleus, glossopharyngeal nerve, Jacobson's nerve, tympanic plexus, lesser superficial petrosal nerve. Then otic ganglion going to the trunk of the mandibular nerve, posterior division of V3, auriculotemporal nerve, parotid. So this is simply easy to remember. So inferior salivatory nucleus from the glossopharyngeal nerve, Jacobson's nerve, tympanic plexus, lesser superficial petrosal nerve, otic ganglion going towards the auriculotemporal nerve. Now the fourth slide which I am going to put, superior salivatory nucleus. This is for the Langley's ganglion or the submandibular ganglion. Superior salivatory nucleus, facial nerve, chorotympanic nerve, lingual nerve, and then you go to the submandibular ganglion, lingual nerve, and then so here the pre and the post ganglionic are the lingual nerve, but you have to remember chorotympanic is going to be preganglionic when you talk about it. Now, the last one, again a screenshot for you. You can take this. So this is for the pterygopalatine ganglion, lacrimal nucleus, going for the facial nerve, the GSPN and the deep petrosal nerve, plexus around the internal carotid artery, forming the median nerve, pterygopalatine ganglion going through the maxillary nerve, zygomaticotemporal nerve, lacrimal nerve, and the lacrimal gland. That's postganglionic. So that is so simple. That is all in this class. So this is what you're going to write. This is what they're going to ask you, and this is what you're going to write. So with this, I complete this class, and I hope that you really enjoyed and understood the pathway of the ganglions, namely the ciliary ganglion, the aortic aortic ganglion, the Langley's ganglion, and of course the submandibular and the pterygopalatine ganglion. Now, so we are now finished up with this. So we are going to have the next coming week, we are going to have 3 important topics, clinical topics. Namely, we are going to have autosclerosis,
complications of CSF.
complications, and I hope you will enjoy all the episodes with me. Thank you very much and have a good night. Thank you. Bye-bye.
Increase the ICP, but cause a severe stretch injury to the brain. It is the wrong answer. And this is what happens. We have seen this. So the answer I'm going to tell you now. We have to open the systems, the atmospheric pressure. Now the brain has high pressure and the systems have low pressure. The gradient of CSF will reverse the brain edema will reverse. This will shift back. Now we're going to show you a few. In other words, let's look at this cartoon. This is the brain. That is the cistern. There is subarachnoid hemorrhage. The cisternal pressure goes up and the brain expands. The answer is yes. Open the cistern stem. Again, we are showing the brain communicates with the cisterns. Subarachnoid hemorrhage basis. This happens. Drain the cistern. Reverse gradient. Brain edema comes down. I'm going to show you some cases. That is a 31-year-old male. Road traffic accident. V1 M3. V1 left pupil dilated. What would you do in this kind of cases? There are a lot of very important radiological signs. You see that is a pre-Pontine or the CP angle system. Okay, the pre-Pontine system is here. The CP angle system is here. It is widened.